1. May help prevent and manage metabolic diseases like type 2 diabetes. A randomized, double-blinded, placebo-controlled trial published in 2012 involving 240 subjects with prediabetes found that taking curcumin for 9 months significantly lowered the chances of people with prediabetes developing type 2 diabetes. Those who took curcumin showed better functioning of insulin-producing cells and lower insulin resistance compared to those who took a placebo. And according to a 2019 review, curcumin has therapeutic potential to counteract diabetes and its complications. Studies have shown that doses of up to 12 grams per day of curcumin are safe, tolerable, and non-toxic. Moreover, a systematic review of 16 studies published in 2021 found that curcumin's anti-diabetic effects may be linked to its ability to reduce oxidative stress and inflammation in the body. 2. May help manage and treat osteoarthritis. In a clinical trial in 50 patients with osteoarthritis published in June 2010, after 3 months of Mariva treatment, a proprietary complex of curcumin with soy phosphatidycholine, the participants experienced significant improvements, a 58% decrease in the WOMAC score, which measures osteoarthritis symptoms, an increase in walking distance on a treadmill from 76 meters to 332 meters, indicating improved mobility, and a reduction in C-reactive protein levels, a marker of inflammation in the body. These positive changes suggest that Mariva was effective in reducing osteoarthritis symptoms, enhancing mobility, and decreasing inflammation. The long-term efficacy and safety of Mariva were investigated in a longer, 8-month study involving 100 osteoarthritis patients. The controlled clinical trial was published in December 2010. The study authors looked at joint-related scores, overall performance, and walking ability on a treadmill, and markers of inflammation in the body. The results showed that Mariva significantly improved both joint-related measures and reduced inflammation compared to the control group. It was well tolerated, suggesting it could be a good long-term option for managing osteoarthritis. In a 2014 retrospective observational study, 820 patients were treated with a new curcuma extract, flexophytol, 4 to 6 capsules per day, for more than 6 months for various forms of painful osteoarthritis. Within the first 6 weeks, flexophytol improved patient pain, articular mobility, and quality of life. Excellent tolerance was reported, and more than half of these patients were able to discontinue analgesic and anti-inflammatory drugs. Patient satisfaction was confirmed by their decision to maintain flexophytol therapy for more than 6 months. However, these data must be confirmed with randomized controlled studies. And in a systematic review and meta-analysis of 8 randomized clinical trials, researchers concluded that there's a scientific evidence that supports the efficacy of turmeric extract, about 1,000 milligrams per day of curcumin, in the treatment of arthritis. However, the number and size of the studies were limited, and more rigorous and larger studies are needed to confirm the therapeutic effectiveness of turmeric for arthritis. 3. May help improve exercise-induced muscle damage (EIMD). According to a systematic review of 11 studies published in 2020, taking curcumin may help in several ways when you're active. It makes the muscle pain feel less intense, reduces damage to muscles during exercise, helps you perform better in physical activities, and fights inflammation. To get these benefits, the recommended dose is between 150 to 1,500 milligrams per day. Take it before, during, and up to 72 hours after exercising. Most people can handle these amounts of curcumin well, with no major side effects. 4. May help with non-alcoholic fatty liver disease, NAFLD. According to research published in the September 2016 issue of Phytotherapy Research, 8-week daily supplementation with 70 mg curcumin may improve various aspects of non-alcoholic fatty liver disease, NAFLD, including reducing liver fat and improving metabolic markers. Moreover, a systematic review and meta-analysis of 6 randomized controlled trials published in 2019 showed that turmeric curcumin supplements led to a significant decrease in 2 liver enzymes, ALT and AST, which are often elevated in NAFLD. This suggests that turmeric curcumin might be helpful for people with NAFLD, especially in studies lasting less than 12 weeks. However, more research is needed to confirm these findings.
By the way, before I continue, if you're new here, I'm Jera from the Philippines.
Welcome to my channel where I share my knowledge and discoveries about everything related to natural health remedies and personal development gained from reading scientific journals and books written by doctors and experts. If you also have a gluttonous appetite for new knowledge, please consider subscribing. Also, you may want to check out my ebook, 40 Wrinkle Fighters Other Than Retinol, backed by scientific studies. Just click the link in the description box below for more details.
Moving on. 5. May help reduce depression symptoms. According to a meta-analysis of 6 clinical trials published in 2016, curcumin administration significantly reduced depression symptoms. The most notable effects were seen in middle-aged individuals, with longer-term use and higher doses having a greater impact. 6. May boost the effectiveness of standard cancer treatments. According to a 2020 systematic review, curcumin reduces the side effects of chemotherapy or radiotherapy, resulting in improving patients' quality of life. A number of studies reported that curcumin has increased patient survival time and decreased tumor markers level. 7. May play a role in promoting cardiovascular health. In a study published in January 2017, researchers explored if curcumin could enhance blood vessel function in healthy middle-aged and older adults. 39 participants were randomly assigned to receive either curcumin supplements, 2,000 milligrams per day, or a placebo for 12 weeks. Results showed that those taking curcumin experienced a 37% increase in forearm blood flow response, indicating improved resistance artery endothelial function. This improvement was not seen in the placebo group. Curcumin also enhanced the response to certain substances that affect blood flow, suggesting better nitric oxide availability and reduced oxidative stress. Additionally, conduit artery endothelial function, blood vessel function in larger arteries, improved by 36% in the curcumin group, but not in the placebo group. In conclusion, the study suggests that 12 weeks of curcumin supplementation can enhance the function of both smaller and larger blood vessels in healthy middle-aged and older adults. This improvement is attributed to increased nitric oxide availability and reduced oxidative stress. In a meta-analysis of 7 randomized controlled trials involving 649 patients, published in October 2017, researchers found that turmeric and curcumin were effective in reducing levels of LDL cholesterol, often referred to as bad cholesterol, and triglycerides when compared to a control group. There was also a potential for lowering total cholesterol levels in individuals with metabolic syndrome, and using turmeric extract might have an even stronger effect. However, the impact on HDL cholesterol, often referred to as good cholesterol levels, was not clear. This shows that turmeric and curcumin can potentially help people at risk of cardiovascular disease by improving their blood lipid levels. However, more research is needed to figure out the best form, amount, and how often curcumin should be taken for maximum benefits. On the other hand, according to a systematic review and meta-analysis of 20 randomized controlled trials with 1,427 participants, published in November 2017, curcuminoid therapy resulted in lower triglyceride levels and higher levels of the good cholesterol, which are positive changes for heart health. It did not change the levels of bad cholesterol or overall cholesterol, though. 8. May help treat scabies. In a 1992 pilot study in 814 participants with scabies, a paste made from neem and turmeric cured 97% of cases within 3 to 15 days. No toxic or adverse reactions were observed. To determine the specific contribution of each ingredient, controlled studies comparing the effectiveness of neem only, turmeric only, and the combination of both would be needed. 9. Has the potential to improve nasal airflow and modulate the immune response in individuals with allergic rhinitis. In a 2016 randomized, double-blind study involving 241 participants with allergic rhinitis, half received curcumin orally for 2 months, while the other half received a placebo. Results showed that curcumin improved nasal symptoms like sneezing and rhinorrhea, as well as nasal congestion by reducing nasal airflow resistance. Additionally, curcumin had various positive effects on the immune system. 10. May help with chronic pruritus or persistent itching. In a randomized, double-blind, placebo-controlled trial in 96 male Iranian veterans with chronic pruritus induced by sulfur mustard exposure, published in October 2012, 1 gram per day of curcumin for 4 weeks significantly reduced the severity of itching. In another double-blind randomized clinical trial in 100 hemodialysis patients with uremic pruritus, published in 2014, the average reduction in high-sensitivity C-reactive protein levels was more pronounced in the group of participants who took turmeric compared to those who took the placebo. In other words, turmeric had a more significant impact in lowering inflammation, as indicated by the decrease in high-sensitivity C-reactive protein levels when compared to the placebo group. The severity of itching was also reduced significantly in the turmeric group. 11. May help improve memory. According to a 2014 randomized double-blind metabolic study in 48 individuals aged 60 or above with untreated prediabetes, consuming turmeric alongside white bread led to an improvement in working memory. This effect was independent of factors such as body fat, blood sugar levels, insulin, or Alzheimer's disease biomarkers. In another randomized controlled trial in 60 healthy adults aged 60 to 85, published in 2015, curcumin significantly improved performance on sustained attention and working memory tasks, compared with placebo 1 hour after administration. It also showed positive effects on alertness and contentedness and lowered total and LDL cholesterol without any adverse effects on blood safety measures. And in a randomized controlled trial published in 2015, 40 participants, aged 51 to 84 years, were given either Curcumin containing 90 milligrams of curcumin twice daily or a placebo for 18 months. Results showed that curcumin significantly improved verbal and visual memory, as well as attention, compared to the placebo. According to the study authors, daily oral curcumin may lead to improved memory and attention in non-demented adults, and these benefits are associated with decreases in amyloid and tau accumulation in brain regions, modulating mood and memory. 12. May have a beneficial effect in alleviating the severity of premenstrual syndrome, PMS, symptoms. In a 2015 randomized, double-blind, placebo-controlled trial, 70 participants experiencing premenstrual syndrome were randomly assigned to either the placebo or curcumin group. They took 2 capsules every day for 7 days before and 3 days after their menstrual cycle for 3 cycles. The study found that before the intervention, the baseline PMS symptoms were similar in both groups. However, after 3 cycles, those who received curcumin experienced a significant reduction in the total severity of PMS symptoms. In comparison, the placebo group had a smaller change. The difference between these changes was noteworthy, indicating that curcumin had a more significant impact. The study suggests that curcumin may help alleviate PMS symptoms, possibly through its effects on neurotransmitters and anti-inflammatory properties. And according to a 2016 clinical trial in 70 participants, the efficacy of curcumin in reducing the symptoms of premenstrual syndrome may be linked to curcumin's ability to enhance the levels of a brain chemical called BDNF, which is associated with mood and overall well-being. 13. May have a potential use for neurological disorders that are associated with low levels of brain-derived neurotrophic factor, BDNF. In a systematic review of 4 randomized control trials with 139 participants, published in 2019, curcumin supplementation, ranging from 200 to 1,820 milligrams per day over 8 to 12 weeks, significantly raised serum BDNF levels. However, there was significant variation among the studies, indicating differences in participant factors like sex, age, curcumin dosage, and trial duration. The significant positive impact of curcumin supplementation on BDNF levels indicates its potential use for neurological disorders that are associated with low BDNF levels. 14. May help with rheumatoid arthritis. In a 2012 randomized controlled trial, 45 rheumatoid arthritis patients were divided into 3 groups: 500 milligrams curcumin, 50 milligrams diclofenac sodium, or a combination of both. The study found that all treatment groups showed significant improvements in disease activity score, DAS, scores. Interestingly, the group receiving curcumin alone exhibited the highest percentage of improvement in overall DAS and American College of Rheumatology scores. Importantly, curcumin treatment was deemed safe with no reported adverse events. This study provides initial evidence supporting the safety and superiority of curcumin in treating active rheumatoid arthritis, suggesting its potential as a preferable option over diclofenac sodium. Larger-scale trials are recommended to further validate these promising findings for rheumatoid arthritis and other arthritic conditions. 15. Could be beneficial as an adjuvant therapy for patients with relapsing or refractory lupus nephritis. In a randomized controlled trial published in 2012, conducted in Lupus Clinic of Hafez Hospital, Outpatient Department of Shiraz University of Medical Sciences, 24 patients with relapsing or refractory biopsy-proven lupus nephritis were equally divided into 2 groups, trial group and control. Patients in the trial group were given 1 capsule containing 500 milligrams of turmeric with 22.1 milligrams of active curcumin, with each meal for 3 months, totaling 3 capsules daily. In comparison, the control group received 3 identical-looking and sized capsules filled with starch, 1 with each meal over the same period. In the trial group, significant reductions in proteinuria were observed at 1, 2, and 3 months compared to the pre-supplementation values. Additionally, systolic blood pressure and hematuria showed significant decreases when comparing pre- and post-turmeric supplementation values. Conversely, the control group, receiving placebo capsules, did not exhibit statistically significant changes in measured variables over the 3-month study period. No adverse effects related to turmeric supplementation were observed during the trial. According to the study authors, short-term turmeric supplementation can decrease proteinuria, hematuria, and systolic blood pressure in patients suffering from relapsing or refractory lupus nephritis and can be used as an adjuvant safe therapy for such patients. Turmeric and curcumin generally have mild side effects, but some individuals may experience stomach discomfort, especially in high doses or with prolonged use. Turmeric has blood-thinning properties, which might be a concern for individuals on anticoagulant medications or those with bleeding disorders. Also, pregnant women should use caution, as turmeric may stimulate contractions. Because turmeric is not bioavailable, there has been development of oral delivery systems for curcumin to enhance the solubility and oral bioavailability, including liposomes, nanoparticles, polymeric micelles, phospholipid complexes, and microemulsions. In humans, curcumin bioavailability was increased by 2,000% at 45 minutes after co-administering curcumin orally with piperine, an alkaloid found in black pepper.
If you've learned something you didn't know before watching this presentation and you appreciate the time I invested in researching, writing, and creating this presentation, please give this video a like. If you're interested in looking and feeling your best and exploring natural solutions, please consider subscribing. Thanks for watching!